Hello, I'm Dr. Daniel Johnson with your tip for the week on bleeding. Is it myth, mystery, or fact? And I became really well acquainted with this topic when I myself was challenged by an independent scientific reviewer that my study in Iraq should not be done because there was an increased risk of bleeding that would be assumed by the soldiers who are participating in the study. So you can read my full summary statement. It's in the portal in the resources tab under practitioner education. Or if you're in a really hurry, just email bleeding@brainspan.com and that will auto deliver this and a few of the other sources that I'm going to be discussing today. So this has been around. This is a big myth. It's been around for a long time, and let's just debunk it. Okay. So one of the first things to do, or fastest, I should say, things that you can do when you're in a bind and you want to just get something that you feel is the strongest piece of information. Go to the Lavazza insert. So when I did my study in Iraq, we worked with Lavazza, which is manufactured by GlaxoSmithKline, and it's just EPA DHA fish oil, and pull out the product insert. They have to mention every possible side effect that was found in their whole drug approval process. So it's a pretty well trusted source of side effects, and you can see that they even address the bleeding myth in there. Yes, it increases bleeding time, but that's not exceeded normal. It doesn't produce clinically significant effects. And furthermore, when we try to find it in people that should have bleeding problems, if there is an association, like in and around the time of surgery, or people who are taking, anticoagulants, we don't see it. Furthermore, just to put the nail in the coffin, we don't recommend you monitor your patients any differently if they're taking these. So there you have it, okay, from Lavazza. There is no published research regarding omega-3 fatty acids and hemorrhage. Here are some of the articles, editorials that summarize this really well, just refuting that there is no evidence. And in fact, studies actually reveal just the opposite. There's actually a lower incidence of complications in and around the time of surgery. There's lower rates of hemorrhagic stroke and total stroke when we have an increase in the amount of EPA DHA. So not only is there no effect, in many cases it actually looks like it's protective when you have bleeding. And this is being used by even major trauma centers around the United States, like Oregon Health Sciences. They use high-dose fish oil in and around the time of surgery. So this is the first really well done 1,500 patients, 2 grams a day of EPA DHA, looking for whether or not there was going to be problems in and around the time of surgery. And so lots and lots of patients, fairly good dose. You can trust this study. It's a good study, published in journal, and they didn't find any increased risk. And if you were going to have a risk, or if you're going to have an association, this is where you'd see it, because you want to look for it when people are bleeding. And that's exactly what they did. And in fact, if anything, it reduced the number of blood transfusions. So there you have it again. There's actually a benefit. So not only is it a myth, it's actually exactly the opposite. And I think when they first saw this increased nose bleeding in Eskimos, when they first were uncovering some of the health benefits and the lower rates of heart disease, they wanted to find a mechanism. They didn't necessarily have all the biochemistry like we have today, and it kind of fit the narrative. Well, unfortunately, people have sort of abused it or misused it. And plus, the reason that you could put all this together and understand it so if they have an increased risk of bleeding in terms of bleeding time, an increased risk of nosebleeds, well, that's going to be caused by AA anyways, not EPA, much more so, because AA is the driver. And you can see that not only is the ratio in the Greenland Eskimos completely opposite as what we would expect at EPA, it's also exactly the opposite of AA. So why don't we give that one a look instead of just focusing on this, because that would be where we should see it. Okay, so you see that we're just focused on the wrong thing. And that's because AA is what produces the thromboxane A2, which is what is the platelet aggregating factor. And that's not where EPA doesn't come over here and shut down arachidonic acid. It produces hormones that are lower in clotting activity, but it's not over here working against AA. It's not a hater of clotting. That's just not how EPA works. So and clotting, the presence or absence is determined by AA. So just a misuse, and it's just kind of unfortunate. I think we're sort of stuck with it. But if you have the evidence, you can always make your case. Good luck. Let me know if you have any questions. Bye-bye.